Anastasia Jarwa. Today, we are going to deal with another topic of fundamental of nursing, which is also related to our health. Health is very important in each and everyone's life. However, there are certain factors that can lead to deterioration of it. So, in this session, we are going to study about what are the various factors that are going to influence health. As we have learned, according to WHO, health is defined as a state of complete physical, mental, social, and spiritual well being, and not merely absence of disease or infirmity. Here, a person is considered to be healthy if he is physically fit, mentally stable, socially active, as well as spiritually healthy. If a person is not suffering from any kind of diseases, he is known to be a healthy person. In order to improve the population health status as well as to reduce the health inequalities, it is very important for us to first identify and understand what are the main factors that protect and promote good health. Here we can see that there are 5 factors that influence health, and these 5 factors are also known as determinants of health. These 5 factors include internal variable, external variable, biological, environmental, as well as psychological factors. Now, let us study about these 5 factors in detail. The first one, which is the internal variable, consists of developmental stage, intellectual background, perception of functioning, emotional factor, as well as spiritual factor. In the developmental stage, we will see that the health belief of an adult is different than that of a child. Here, it simply means that the way an adult perceives health and the way an adult take care of his own health is different from that of a child. Here, an adult has more knowledge about what are the various factors that can improve their health. So, therefore, they will be striving hard in order to reach their goals, and also they will always be ready to adopt any methods which can improve their health. For example, when we provide any medications through injectable form, the adult knows that this can cause pain, but still they'll be ready to take it because they know that they'll be getting so many benefits from it. However, if we provide the same injectable form to the child on seeing this itself will start crying or will not want to take this injectable form as they don't have any knowledge about what are the benefits they are going to get. The only first thing that comes to their mind is it is gonna hurt. So they will not be ready to take this injection. The level of growth and development also plays a very important role in this developmental stage. Moving on to the next, which is the intellectual background. Here, it is very important for a person to have a concept about their physical functioning as well as illness. Here, it is very important for the person to have a good knowledge regarding the factors that can affect the health as well as the knowledge regarding various other methods that one can adopt in order to get a good health. The educational background also plays a major role here, as the more educated a person is, the more knowledge he will be having in order to improve his health status. For example, people who are working in medical field have more knowledge regarding the various methods and factors which they can adopt in their day-to-day life in order to improve their health more than the people belonging to the other educational background. The past experiences here also plays a major role in order to help an individual maintain a good health. For example, if a person has been suffering from tuberculosis, he will know what are the signs and symptoms, what are the causes, what are the medications, as well as what are the preventive measures which he can take in order to avoid this kind of disease. So, because of his past experiences, he can then adopt various methods which can help him as well as his family members or the people around him to not suffer from this kind of disease. Moving on to the perception of functioning, the way one perceives health is different from the others. The way one perceives their physical functioning is also very different from the others. For example, if a person is suffering from excessive hair loss, this can be because of a condition known as alopecia. However, that person may be thinking that he is getting the signs and symptoms of cancer. Therefore, it is very important to first know how a person perceives his or her own health. So, if this kind of person comes to the clinical settings, it is the duty of the nurse to attain both the subjective as well as the objective data. The subjective data is the data which we will be collecting from the patient. For example, if a patient is admitted, we can go to them and ask, "How are you feeling today?" If the person is having stomach ache, he may say, "I'm having pain in the stomach." So that is known as a subjective data. Subjective data, as I've said, is a data which we will be collecting from the patient. Whereas the objective data is the data which we will be assessing after we have collected the subjective data. For example, again, if this person is saying that he is having stomach pain, what is the first thing we can do in order to assess whether he is really suffering from it or not? We can use an instrument known as pain measuring scale and then detect the pain scale of the person. Here, if the person is really having this stomach pain, through the use of this pain scale, we will be able to get an idea of the pain he is suffering through. The emotional factor consists of fear, depression, anxiety, as well as stress. Here, these emotional factors plays a major role in influencing the health. Why? Because if a person is already physically unhealthy, this can lead to many changes in the emotions which can also affect the psychological being of a person. For example, in case of coronavirus, this virus only affects the body of an individual. However, once the person comes to know that he or she is suffering from this kind of disease, this then also affects them not only physically but also mentally, because this physical condition of the patient can also have an influence on their thinking and perception, which can later cause more deterioration in the health, as this person is not only suffering physically but as well as mentally. Moving on to the spiritual factor, as we all know, different religions have different beliefs. Therefore, it is very important that we must know what are the restrictions that one religion follows before providing any treatment to any client. Some religion restrict the use of certain form of medicinal treatment. So as a nurse, we must first understand the client's spiritual level in order to involve them effectively in the nursing care. Moving on to the next variable, which is the external variable. Here, it consists of family practices, socio-economic factor, as well as their cultural background. These family practices consist of the various methods and factors which one chooses to follow. This also depends on how the family make use of the healthcare services which is provided to them. For example, as soon as a mother gives birth to a baby, it is the responsibility of the parents or of the family members to provide the necessary vaccination as well as immunization to the newborn as well as to the mothers. These immunizations need not to be given only once, but they have several other doses which needs to be given to the child during their phases of growth and development. So if the family members or if the parents wants their child to lead a normal life, they should be responsible providing these immunization in order to help the child lead a healthy and a normal life in the years to come. There are various other healthcare services which are also provided to the people in order to improve their health, such as blood donation camps, eye camps, providing of vaccination and immunization. So here it depends on the family how well do they utilize these kind of healthcare services. If any member of the family is sick, it is also the responsibilities of the family members to take care of the patient as well as to adopt the various preventive measures in order to improve the health of the individual. Therefore, these family practices also plays a major role in order to improve the health of the individual. Next, moving on to the socio-economic factors. This factor consists of psychosocial variable as well as emotional variable. These psychosocial variable includes the lifestyle which one is following, the diet, the exercise, as well as the habits which one follows in their day-to-day life. If a person is involved in any of the bad habits such as drinking, smoking, or drug abuse, this can lead to many factors that can affect their health. Here, the environment in which one works also plays a very important role in influencing their health. For example, if a person is working in a textile industry, he is at high risk of developing the occupational lung disorder such as bicyanosis, silicosis, pneumoconiosis. Why? Because he's always exposed to the cotton or to the dust, which can lead to various other respiratory infections that can affect their health. Moving on to the economic variable. This is usually caused because of poverty. There are high chances for these type of people to develop from certain kinds of diseases because since they don't have the proper food to eat, proper shelter, as well as a good lifestyle, this will lead them to cause from various kinds of diseases or disorders such as malnutrition as well as many other deficiency disease such as kwashiorkor, marasmus, which is usually caused because of unhygienic lifestyle as well as not proper intake of food. Different people have different cultural beliefs. Some people believe that illness is due to a punishment which has been given by God to them because they have done wrong things. However, this is not the case. Some people believe that illness is caused because of the unhygienic environment which they lived in, whereas some people believe that illness is caused due to their aging. So here we can see that different people have different belief regarding their illness as well as their treatment. So before providing treatment to any client, it is the responsibility of the nurse to be aware of the cultural practices which that particular client is follow in order to get a good result. Moving on to the third factor, which is the biological factor, it consists of pathological microorganisms. These microorganisms are the one which can cause various diseases in our body. These microorganisms include the bacteria, fungi, protozoa, as well as viruses. These microorganisms are very harmful to our body and can lead us to suffer from many kind of diseases. For example, tuberculosis is caused by a microorganism or we can say by a bacterium which is known as Mycobacterium tuberculare. So different microorganisms can lead us to suffer from different kind of diseases. The hereditary factors also plays a major role in influencing our health. Many hereditary disease can also alter the health status of an individual. For example, there are certain hereditary diseases such as hemophilia and also diabetes mellitus. If our parents are suffering from diabetes mellitus, there are high chances for us to also develop this disease in our lives. There are other factors that can also influence our health. This include the age, the gender, as well as the growth and development. Age. We can see that the newborn as well as the old adults are more prone to suffer from many kinds of diseases rather than the adults. Why? Because here we can see that the immune system of the newborn and the older adults are lesser than us. Gender, there are some diseases that mostly affect men, whereas there are other kind of diseases that mostly affect women. Men are prone to be suffering from any heart attack or heart diseases, whereas we can see that women are more prone to be suffering from diseases like hypothyroidism as well as breast cancer. So this age and sex also plays a major role in influencing the health of the individual. The environment in which we live in also affects our health. For example, if there's so much of air pollution, water pollution, soil pollution, this can lead to deterioration of our health. If we are constantly breathing in a polluted air, it can lead to various kinds of respiratory diseases such as asthma or bronchitis. If we are consuming huge amount of the uncontaminated water, it can also lead to various waterborne diseases such as cholera. The social environment also plays an important role here. Why? If we are not socially active or if we are living in an environment which is not suitable for us, it can also lead to various kinds of mental disorders which can affect us both physically as well as mentally. Here, lifestyle also plays a major role in influencing our health. The food we eat, the long time habits which we have, as well as the activities which we follow in our day to day life can also help us to attain a good health status. Various other psychological factors such as the emotions, the feelings also plays a major role in influencing our health. If we are emotionally stable, it will help us to attain a good health status. Whereas if we are physically unhealthy as well as emotionally unstable or mentally unstable, this can lead to further deterioration in the health status of an individual. So here we have come to the end of this topic. In today's topic, we have discussed about the various factors that influence health. So here we have come to know that there are 5 factors that usually influence health. The first one is the internal variable, the second one is the external variable, the third, which is the biological, the fourth, which is the environmental, and the fifth, which is the psychosocial. So, as we've come to know about these factors which can affect our health, we must try our best to adopt various methods as well as take our own responsibilities of our health so that it will help us to maintain a good health status. So I hope you guys have understood this topic. We will be meeting in the next session where I'll be dealing about further more topic which is related to our health. Thank you.